So when we talk about the risk to cardiovascular patients or patients with heart disease or diabetes, that type of scenario, vascular disease, high blood pressure, those people are at slightly increased risk to respond poorly to an infection. But as a population, we're all equivalent in our risk to get the infection. One of the things about the virus is that it's very infective. It's probably the second most infective viral agent that we've known, second to measles. But that transmission is the same regardless of your underlying heart or lung or other medical issues. The concern is how your body handles the infection once you do have the infection. If you do have heart disease, COPD, diabetes, vascular disease, this group of people have an increased risk of responding poorly to having the infection. The older we are, the more challenged we may be from an immune response standpoint, and the more difficulties we may have. We take a stance in cardiovascular medicine to say this: you need to prevent in every possible manner getting the infection. Follow social distancing, wear masks, and wash your hands frequently. Be thoughtful about those that you're around. Once you think that you have an infection, it's important to document that. So talk to your physician about getting tested. Understand what that means to have a test done, the timing of the test, the results, etc. Staying hydrated and doing self-care activities, meaning getting plenty of rest and being thoughtful about your food intake and taking good care of yourself during that infection. It's not only the illness itself that we worry about, it's some of the issues that we're seeing in heart disease in the convalescent phase, meaning the phase after the infection. And we're seeing young people come back with strokes. We're seeing people come back with cardiomyopathies, meaning a weak heart muscle. I'm sure that most people have heard of the chronic fatigue syndrome that sometimes occurs after, where people just feel profoundly tired. Sometimes that's all it is, but sometimes that fatigue syndrome is a marker of other illness. Either it's infected the liver in an abnormal way, or the heart in an abnormal way, or the blood vessels in an abnormal way. So we're seeing that more and more now as the population becomes more and more exposed and more individuals are presenting, and it's very concerning. This RNA vaccination is very safe. It's very focused, and that's why it has a very high efficacy. So if you do have a vaccine, your symptoms are going to be truncated. You may not get a lot of symptoms at all, and your potential for infectivity to others is likely markedly diminished. So that's exactly what we need to accomplish in the pandemic. You could say, I can have a sore arm, or I can roll the dice and see how I'm going to respond to this virus. And it really doesn't matter if you're 20 or if you're 70, there's still some element of risk, and we see that with unfortunate patients that pass away in the hospital every day, and we see patients left with comorbidities or illnesses that don't recover the rest of their life. So I think those are really the two options, and that there's really no reason not to proceed because of the safety and efficacy of the vaccine itself.